Thank you so much to everybody. I want to jump right in with what makes the difference. We've heard a lot about the science behind this ingredient. We've heard about the history, about how it's been used and developed and proven all around the world. And it's interesting here that we're getting things translated into Korean, because this ingredient has been used by people in Korea for quite some time now, in fact, for many years. And here's one thing I do know about the Korean people. They are typically so far ahead of the rest of the world in terms of knowledge about health and wellness. And so when we have Korean people, whether it's Korean Americans in California or in South Korea itself, when we have Korean people repeatedly using a particular dietary supplement, we know that it proves that this is effective. Koreans are nobody's fool, I have learned that. But let me just explain a little bit about why do we have 4 formulas. Well, when we, oops, sorry about that. When we started with one formula, and we flew to Norway. We met the owners of the YTE ingredient themselves, and we consulted with them very deeply, and our own biochemists, formulators, the manufacturers, researchers, etc. And the first formula that we started with was amino boosters. And that is a very good formula. It's our original one. It works, as you've heard from a lot of people taking amino boosters, and I know we have some people in the audience, Michelle and Karen and Grant, I saw you earlier, and I know you've got your own remarkable stories to tell that have been spanning several years. But amino boosters is a good formula. We then made another formula, Telomine. Telomine and amino boosters share a lot of similarities in their formula. Telomine also includes Rhodiola rosea, one of the herbal botanicals that we include. And I suppose that the formula of Telomine is the most advanced formula of any of our health evolution PLAN, pure live active nutrition solutions for people. And so the only issue with amino boosters and Telomine.
Angela.
I hope you can hear me okay. Tell me if there's a problem. Oh, I better stop for the translator. Thank you. So I was saying, we have amino boosters, we have Telomine. They share a lot of similarities. Telomine is the advanced formula, also containing Rhodiola rosea. We developed the Telomine formula 3 years ago. We developed the amino boosters formula nearly 6 years ago. Thank you, translator.
That most of the time people take supplements and they're not sure if it's doing anything, right? I've heard this happen a lot. I've been somebody that's taken a lot of supplements. And if you're not feeling the effect and you just keep taking it, then are you just wasting your money?
보통 이제 주변에서도 그렇고 저를 포함해서 보충제를 많이 드신다고 하는데 효과를 못 보시는 경우가 많이 있잖아요. 그러면 그냥 돈 낭비인 것 같습니다.
Yeah. So what I keep hearing is people are feeling the difference. Okay, when you are sleeping better, you are going through the day with much more energy. You're able to manage stress. If you are feeling that personally, then that means something.
만약에 어떤 보충제를 드셔서 잠도 잘 자고 활동도 더 잘 하시고 그다음에 스트레스도 적게 받으신다면 그거는 확실히 효과가 있는 거죠.
But if there's science behind it, then that is the validation.
그리고 과학적인 그 증거가 뒤에 있어요. 그래서 이제 이게 확실한 저희가 이제 보증을 할 수가 있는 거죠.
I'd like to ask the audience, how many of you feel like you eat a good diet? Raise your hand.
몇 분이나 지금 제대로 식이요법을 잘 하고 계신다고 생각하세요?
3 people? 4 people? No one else? How many people here think maybe I could probably eat less sugar?
이 중에서 설탕을 좀 줄여야겠다, 단 걸 줄여야겠다 생각하시는 분? 손 들어주세요.
Yeah. How many people here feel, well, maybe I could eat less carbohydrates, less bread, less starch?
빵이나 그 탄수화물을 좀 적게 먹어야겠다 생각하시는 분?
How many people here feel they eat a lot of vegetables?
야채를
A lot of vegetables.
굉장히 많이 드신다고 생각하시는 분?
Okay, so if the diet is not there, then how can you experience good health? You have to supplement.
네, 식이요법을 제대로 하고 있지 않으시다면 어떻게 건강을 유지할 수가 있을까요? 그래서 저희가 이제 보충제를 드리는 겁니다.
But I'll leave you with this. If you do both, you eat well and you supplement, Superman.
그래서 이제 제대로 식이요법 하시고 보충제도 드시게 되면 이제 슈퍼맨이 될 수가 있는 거죠.
A woman should never tell her age, they say. But I will share with you, last month I turned 51.
보통 여자는 이제 나이를 잘 얘기 안 하잖아요. 근데 이제 제가 작년에 51살이 되었습니다.
So, by eating well and supplementing well and taking care of my health, I believe you can age backwards.
Okay, everybody, can you hear me? George, give me the thumbs up if you can hear me again. And thank you so much. Yes, that's good. Thank you so much, Maria, our Master of Ceremonies. You are exactly right. So I was talking about amino boosters and Telemind containing similar ingredients with the addition with Telemind with Rhodiola rosea. And why do we do that? Because everybody and every day is different. Now, there are a few people who cannot tolerate one ingredient which is contained within both amino boosters and Telemind. That ingredient is ginkgo biloba. Ginkgo biloba is one of, if not the most used herbal supplements. It's been used for generations and generations, and we use a particularly pure, proven type of ginkgo biloba because it's all about the quality and the purity and the quantity as well, as we've heard. But some people cannot take ginkgo biloba, typically people who are on blood thinning medication or epilepsy medication, or maybe pregnant or breastfeeding. And that is largely because ginkgo biloba is a natural blood thinner. That's one of the ways it's so effective, is because it enables the blood to pump around the body more efficiently, particularly into the brain and through the brain. But if you're taking a prescribed blood thinner, for example, you can have too much. So if somebody is on blood thinning medications, for example, warfarin, or epilepsy medications, or is pregnant or breastfeeding, it is a contraindication to take the ginkgo biloba, which is in amino boosters and which is also in Telemind. And so we created, in response to popular demand, repeated demand, because it's expensive and time consuming to produce another formula, but we produced the formula called amino B12. Amino B12 does not contain ginkgo biloba. It does contain full clinical dose of YTE, and we've heard a lot about the YTE, young tissue extract dynamic protein. We've heard a lot about that. And that's been proven for over 90 years, 90 years, with no contraindications, no negative side effects for this YTE ingredient. So we're committed to providing formulas with the correct recommended clinical dose. And we've got that in amino boosters and Telemind and amino B12. Amino B12 doesn't contain ginkgo biloba. So if somebody is on blood thinning medication or epilepsy medication, or is pregnant or breastfeeding, amino B12 is the option. What did we put in amino B12? We included obviously B12, as you can tell from the name, but not just any B12. We included mecobal active, which is a patented form of B12, so that the purity, the stability, and the bioavailability is guaranteed in every single capsule. It's actually made by a company called Ferra Health Tech. It is many, multiple times more expensive than nearly all of the cheap B12 on the market, but it's worth it because you can actually make use of it. So we include B12, we include YTE, and we include bioperine. Bioperine is a botanical. It is from the black pepper, actually. And again, it is a patented version so that you've got the purity, the stability, the bioavailability. And what this bioperine does is it enables nutrient absorption, not just from your supplements, but also from your food. And in some cases, up to 2000% more nutrient absorption by you. So we see remarkable results from any of these three formulas that we have, all containing the recommended clinical dose of YTE, amino boosters, Telemind, and amino B12. Now, I know that a lot of companies will try and just have one formula. It is much cheaper and easier for a company to produce one formula and pretend that one size fits all. But we know humans are all different. We are all so different. And because everybody and every day is different, that's why you need to look at which formula specifically is right for you. And then our fourth formula is Amino Serene. Amino Serene first came to our attention actually from the provider of YTE. Now, we have been granted exclusivity with YTE after our 6 years of working with it, after being the only company on the planet that's always been completely loyal and committed to this ingredient and ensuring people access the genuine ingredient at the recommended clinical dose and with good value pricing. The owners of YTE have entered into an exclusivity agreement with us. But here's the funny thing. The Kai Berg is the guy who manages this provision of YTE. And Kai said to me one time, a few years ago now, I love what you're doing. I love all of your formulas, but I've developed a formula. I've had it developed for me, and I think it's better. For some specific purposes, I think it's better. So we said, send us some. We want to know. Sent some to me. Teresa tried as well. If you know anything about our company, you'll probably speak to Teresa. And of course, we looked into the science. And of course, we had it third-party tested. And of course, we worked with our biochemist team, our manufacturing team. We looked into every aspect of it. And why I looked into it so seriously is because Mr. Kai Berg has access to supplements, dietary supplements from around the world. That's his specialty. He's a dietary supplement ingredient specialist. He can take whatever he likes. He knows far more about dietary ingredients than the vast majority of people. And yet he was saying to me that this particular formula with YTE and all of the B vitamin complex and ashwagandha and L-citrulline was a specifically useful formula to him. So from our research, we discovered that yes, for some people, it is particularly useful. And so that's why we have 4 formulas now. Now, we personally recommend Amino Serene as a supplement, as an additional supplement to take with one of the other 3. Amino Serene is our only supplement that does not contain full clinical dose. I don't know if I can hold this up to you. It'll probably come over backwards. Yes, it's coming out backwards because I've got the camera looking at me. But anyway, this is Amino Serene. We recommend taking that as an adjunct to either amino B12 or amino boosters, or Telemind. So these 3 contain full clinical dose. You can just take one of them, or you can, in addition, take this one. A few people just take this one. But we strongly recommend full clinical dose of YTE. And in the same way that access to all of the amino acids in perfect natural balance is much more effective than just taking some at different ratios. Taking all of the amino acids works really well. Taking all of the B vitamins at the right clinical dose works really well as well, which is why we recommend the two together. So either these 2 or these 2 or these two. Now, of course, you can just take one if you wish, or you can transition between different ones, because every day and every person is different. What do I take? I take them all, actually. Typically, I'll take Telemind and AminoSerene every day. Sometimes I'll take Amino Boosters and AminoSerene every day. Sometimes I'll take Amino B12 and AminoSerene, or sometimes I'll take a whole mixture. But everybody is different, and that's why it's well worth finding out for yourself what works best. If you're unsure, start with Telemind. If you can, start with AminoSerene as well. If cost is a real issue to somebody, you could take Amino Boosters. As I said, Amino Boosters contains less ingredients than Telemind, so therefore we can manufacture it a little more cheaply. If you can't take ginkgo biloba, take Amino B12. If you're a highly sensitive person, and by that, I mean, you might be an entrepreneur, you might be in business, you might be an empath, you might be sensitive in a number of ways. And why I include entrepreneurs and business people is most of us are in business because we're driven to solve a problem. We are so sensitive to a particular problem or issue, we are driven to solve it. And that is true whether you're a medical professional or a researcher or in any kind of business and any kind of entrepreneurialism. So people in business and entrepreneurs are typically driven because we can't just ignore a problem. We can't just ignore an issue. We want to fix it. But some people might be sensitive in other ways. They might have IBS or autoimmune or all kinds of different sensitivities, emotional fragility, mental low mood or whatever. And so AminoSerene is particularly useful for that. But I will say this, any one of our formulas has transformative effects. And you can talk to the people in the room after this and hear for yourself some of their testimonies, as well as look on our website and look at the independent science, the links to independent studies, and you can see for yourself how effective these ingredients are. So I hope that's explained a little bit more about how our formulas work and why we got involved in the first place. We got involved because there's this remarkable ingredient, and it was not being made available to people. It was not being made available correctly to medical professionals, to health specialists, to ordinary people, maybe like you and me. It was not being available with the genuine ingredient and not at the recommended clinical dose. And in fact, a lot of companies were using the story, but then massively overcharging, and in some cases not even including any of the ingredients. So that's why we became involved. That's why we're here today. And I am so grateful, so incredibly grateful to have your attention and to be working with a remarkable team of people. For me to have world famous doctors, surgeons, researchers, nutritionists, specialists in all fields of integrated health is remarkable. And I feel very blessed and also very responsible to ensure that we can communicate and enable people to know they can access these transformative formulas. Now, if you know somebody who is struggling financially, we do have a pay what you can program. We're quite unique like this. And on our website, in the footer at the bottom of the website, there is a pay what you can link. When we first introduced this, I was very nervous. And some of our team said, "Are you crazy?" But we are able to sponsor people every week who we can sponsor some access to our ingredients. Now, of course, we can only do this for a small number of people. Of course, nearly everybody has to pay the recommended price, and it is very fair. We're committed to that as our third strand of genuine ingredients, recommended clinical dose, and always good value pricing. But some people, for whatever reason, are struggling financially, so we have a pay what you can program. Also talking about finances, of course, to communicate this with people, it's not just good enough to have wishful thinking and hope that people know about it. We need to go out of our way to ensure people do know about it. And that costs money and time. So we can either pay Google and Facebook principally for advertising and communications and marketing. But we can also reward affiliates who spread the word, because time is money. So we have a very, very robust affiliate compensation package. We've actually worked with experts in this field who have devised a very fair, transparent, honest, generous compensation package, so that people who share this information, whether they're doctors prescribing to their patients or whether they're just people who have found out about it and recognize, gosh, so-and-so would like that, or I'm just going to tell people about this and perhaps give them a discount coupon or something. So we have lots of methods of being able to communicate. And I'm very honored as well that this year we have been selected to appear in one of Lawrence Fishburne's documentaries. Lawrence Fishburne is the documentary maker, actor. He was in The Matrix actually years back. But Lawrence Fishburne's documentaries are called Behind the Scenes, and we've been selected for his new series, which is all about innovation in health and wellness. And that's going in front of 80 million US households in prime time later this year. We're filming in a few months' time. So we're really getting serious now about making sure people can know about this. And that's why I'm so grateful to have your help with this as well. So I hope that's helpful. I would like to suggest now that I turn it over to you in the room. You have people here who can help you. We have Mrs. Young Rishin, we have Mr. Joseph Choi, who can help you get involved. We have product here for you to take home with you as well. And I would just like to close by thanking our speakers. I'm very grateful to you. Dr. Witt, Dr. John DeWitt, Mr. David Saloff, Mr. Leonard Makauka, June Kang, for helping to organize this as well, Mr. Joseph Choi, and our super MC, Maria Ibrahim, thank you. Also to Fieldwork Fullerton with this super venue. We're very grateful to be here. We actually have open house meetings here twice a week when you can meet up with Joseph Choi or Mrs. Young or whomever. Thank you so much. We're going to draw a raffle actually for the people who are here in the room. So I'm going to close by saying thank you for being here. I'm going to stay live online for those of you who are here live online. And I'll let you in the room, you're going to have a raffle to win 3 bottles of Telemind, and also we'll be able to answer any questions. People there will be able to answer any questions. Thank you so much. This is Angela Wright, co-founder at Health Evolution. We have a big responsibility to ensure people know about this transformative solution. Thank you for being here.